Good evening, madam.
Good
Warm
evening.
welcome to the our course on cochlear implantation for audiologists, madam. From Kim's Hospital conference, we all have gathered here. Almost 25 audiologists are here right now. So it's our pleasure, madam, to invite you through our mentor, Shiva Prasad sir. So coming to the introduction about Madam Meenakshi Kusari, that is, who has Madam has did her alumni of All India Institute of Speech and Hearing, who did her masters in audiology, and Madam is guest faculty at Ali Awarjang National Institute for Speech and Hearing Disabilities Regional Center since 8 years, and Madam has got immense experience clinically of 11 years as an audiologist and speech language pathologist. And Madam is working currently with pediatric population, that is mostly diagnostic and rehabilitation. And Madam has done recent ComDeal certified for early intervention in ASD. Now, Madam, the session is open to you. Thank you.
Thank you. Good evening, one and all. It's a pleasant uh, experience to be among you all. I would definitely try to share whatever knowledge I have on cochlear anatomy and its neural connections. And I hope my presentation will help you to understand the cochlear anatomy a little better. And I know you already have studied that in BSc and MSc levels, but again, we will just recapitulate our knowledge. Maybe some small details will be added that will help you to understand the process better. Can you hear? Am I audible?
Yeah,
Yeah. I need to share my screen. So
yeah, I'll make you as admin.
Yes, everyone keep your mobile participants display. The screen in their face. And object.
Yeah, Meenakshi, you can share your screen now.
is it visible?
Yes.
Is my
Yes,
screen
ma'am.
visible?
Yes, ma'am.
So at the outset, I would extend my gratitude and thanks to Dr. Shiva Prasad B for bestowing his trust on me. This is the second session of the course which I am taking this class. I hope I live up to his expectations and can give you all a good insight. So, as we are talking about cochlea, we are all aware where the organ is situated and how important it has it in hearing. We will be going through the anatomical landmarks in the cochlea, the major anatomical landmarks that are the macro level landmarks, and also some smaller and finer details that are the micro level landmarks, which will help us to understand the anatomy better and also the neural connections. So these informations are already known by most of you, but still I'll be just going through them very briefly. So cochlea is a snail shell shaped organ which is situated in the innermost part of the ear, and it is responsible for hearing. And the inner ear as such is also responsible for balance along with hearing. As we all know, we have cochlea in both the ears, and both are almost mirror shaped, and they have certain characteristics. For example, they are coiled, it's snail shaped, so it is coiled, and it is fluid filled, it has some fluid inside the cochlea. And these are basically located in the petrous pyramids of the temporal bones. So we all know the importance of temporal bone in hearing. So the cochlea or the inner ear is located inside the temporal bone. And the human cochlea is composed of 2 and 3/4 turns. So since it's a coil, it's turned around a base or a stand, and it has 2 and 3/4 turns usually. But of course, there are some unusual anatomy in normal hearing as well as hearing impaired population, which may again affect the way the electrodes are being inserted inside the cochlea during an cochlear implantation. The cochlea is surrounded by a compact bony structure, the otic capsule, and this bone is the hardest bone in the body with a trilaminar arrangement with islands of modified cartilage, and it has a very high mineral content which increases the stiffness of the bony labyrinth. So we are just seeing the location of the inner ear. It is at the petrous part of the temporal bone, and it lies basically between the middle ear and the internal acoustic meatus. So as we enter the ear, we all know there is this external ear, then there is the middle ear cavity, and the middle ear cavity opens into the inner ear. So we can say the lateral part or the side of the inner ear is by the middle ear, and medially, that the inner part of the inner ear is the internal acoustic meatus, from where the auditory nerve basically leaves the inner ear. And the inner ear has basically two components. One is the bony labyrinth and another is the membranous labyrinth. We all know labyrinth, the word labyrinth is it's a collection of chambers or tubes which are little confusing. So that's why when we go through the anatomy, we'll see that's why the word labyrinth is being used. Very interestingly, since the cochlea is coiled, if we straighten the cochlea, like the coil is straightened into a long tube, the outer surface of the tube is bone. Okay, so it's a bony tube. And inside the bony tube, there is a fluid. And again, inside the fluid, there is a rubber tube. So that is how the structure is. So there is a bony tube, then there is a fluid presence, and then there is a rubber tube. That's the membranous labyrinth. And inside the rubber tube, there is again a fluid. Okay, so that is the basic arrangement inside the cochlea. This slide again talks about the inner ear location if we view it from a different angle. So here we can see both the cochlea and inner ear position. Okay. Some other views. Since it's an anatomy class, we will try to introduce as much as diagrams possible so that it becomes easier for us to locate and understand the particular position of different structures and landmarks. So if we see compared to our front face, the position of the ear and inner ear should be like this. And as I was saying, if the cochlea is straightened, it becomes into a long tube, and the outer surface of the tube is bony and inner surface is membranous with fluids inside. Okay, so before we enter into the cochlea, we have a little importance with respect to cochlear implant is the middle ear opens into the inner ear through two membranes or two windows. Okay, so one window is basically the oval window on which the stapes foot plate sits, and the oval window opens into the scala vestibuli. Scala vestibuli is a part of the cochlear duct or the cochlea as such, and there is another window which is the round window which is present in a niche which forms a membrane over the scala tympani. We'll see these structures later, but why I mentioned these two structures here, because the round window is going to be an important structure with respect to cochlear implant surgery. So if we again go back to the inner ear components, basically there will be three components: vestibule, cochlea, and semicircular canal. So it can be viewed as a house. Okay, so when we enter the house, we can enter through these two inlets. But if we enter through the round window, it opens into the living room, which can be the vestibule. Okay, so vestibule can be the living room with two families staying on either side with different kitchens, bedrooms, etc., for them. Okay, so one family stays in the part where there is semicircular canals. This family is responsible for the balance of the body. The other part stays in the cochlear part, which is responsible for the hearing. Okay, Now, this is a schematic diagram. This is a diagram, but if we actually see the structure of the cochlea is slightly anteriorly placed compared to the vestibule, and the semicircular canals are little posteriorly placed. So the cochlea is in the front, then the vestibule, and slightly behind or posterior is the semicircular canals. So we will not be talking about the semicircular canals or the balance system here in this presentation, but mostly about the cochlea. Okay, so again there is this picture which shows the vestibule, the living room, and the cochlea, which is our main interest of organ, and the semicircular canal. Now, the cochlea, as I said, it has a bony labyrinth and membranous labyrinth, or the whole hearing structure can be divided into a bony labyrinth, a bony tube, and a membranous tube. So, if we see the bony labyrinth, it is a series of bony cavities within the petrous part of temporal bone, and the vestibule being the central part of the bony labyrinth, and it is separated from the middle ear by the oval window, and it also holds the saccule and utricle, and anterior to the vestibule is the cochlea, and posterior to it is the semicircular canal, as I just mentioned. These are some other views of the cochlea with respect to the whole ear or the middle ear system. So if you can see, these are the ossicles or the middle ear system. This is the stapes. It opens into the oval. It sits on the oval window, and here is the cochlea. Okay, and here there is a cross section of the cochlea. We have just removed a slice of the cochlea to show the inside. And now here, if the ear is held vertical, this is the position of the cochlea with respect to the middle ear and the semicircular canal. This is some other view. So when we will be doing the next slides, what we will be doing is we will be making the cochlea in a vertical position to understand it better and see the structures through which we can understand its anatomy better. Okay. So the cochlea is positioned anterolaterally, as I was saying. The cochlear duct runs through separate two perilymph-filled chambers, scala vestibuli and scala tympani. So as the cochlea has the bony labyrinth, it will be having some partitions. As I already said, there is a fluid-filled chamber, and inside that there is a cochlear duct or the membranous labyrinth. So this cochlear duct basically separates out two different chambers, one above and one below. One is the scala vestibuli and one is the scala tympani. Now the cochlea coils around a structure called modulus, taking a spiral cone shape, and there is spiral lamina which flanges out from the modulus and holds the cochlear duct, and the cochlear apex. The apex of the cochlea faces the middle ear cavity, and the auditory nerve branches at the base of the modulus. So if we go back to the previous picture, this is the apex. Apex is like the topmost structure. This is towards the middle ear cavity, and the base is towards the place where the auditory nerve leaves the cochlea and enters the internal auditory meatus. So this part we are just going to go through very swiftly. The bony labyrinth also has the semicircular canals, the balance system. There are three semicircular canals, the anterior, lateral, and posterior. And the semicircular canals also contain ducts, which are membranous and which are also responsible for balance, which are the utricle and saccule. And the canals are situated superior posteriorly to the vestibule, which we already discussed. So now we come to the membranous labyrinth, which is inside the bony labyrinth. So this is called the cochlear duct. It is responsible for hearing. And the membranous labyrinth is a continuous system of ducts filled with endolymph. It lies within the bony labyrinth surrounded by perilymph. So the two fluids which I was mentioning earlier, one which is just inside the bony tube is the perilymph, and inside the membranous tube there is a fluid called endolymph. Okay, so if we see this particular picture, the grayish part is the bony tube. Okay, this is the bony tube, and if we remove a slice of the bony tube, inside we can see the fluid. Okay, the fluid which is inside the bony tube and the cochlear duct which runs between the fluid. Okay, the fluid filled space above the cochlear duct is the scala vestibuli, and the fluid filled space below the cochlear duct is the scala tympani, and the cochlear duct forms the scala media. Okay, I'm sure you all are aware of all these names. I'm just trying to highlight the structures in more details. So the cochlear duct is located within the bony scaffolding as we discussed, and it is held in place by the spiral lamina. Okay, now this particular orientation is a vertical orientation. What we have been seeing till now, where in a, sorry, I'll just go back, where in a supine position. Okay, so here in this picture, it's just a vertical position. We are just straightening up the whole structure. And this snail-like structure or the coiling is around a modulus or a stand kind of a structure. So we can also simulate it, or we can give the analogy of a screw. So the middle part of the screw is formed by this spongy structure. This is the modulus, and the flanges or the screw flanges are formed by the osseous spiral lamina, around which the cochlear duct is wrapped. So the presence of the duct creates two canals, as we said, and the lateral worm is formed by the thickened periosteum known as the spiral ligament. So when we see the screw, there are two sides. One is the medial side, that is towards the modulus. Okay, and then there is the lateral side, this side which is exposed outside. So this lateral side is formed by it is held by a structure called spiral ligament. Okay, and the roof is formed by a membrane. So this duct and this area has to be separated out by something so that the fluids inside both the ducts do not mix up with each other. So the roof is basically formed by a membrane called Reisner's membrane, and the floor of the duct is formed by a membrane called Basilar's membrane. So if we see, it has four sides. One is the medial side, which is formed by the modulus, the lateral side, which is formed by the spiral ligament, the roof, and the floor. Okay. So I think we are just going to skip this slide. Okay. So now if we see the cross section of the cochlear duct, the picture looks like something like this. So what we were talking about, separating out the tube. So this is the scala vestibuli, the vestibular cavity. This is the scala tympani, and this is the scala media. And all these three compartments are fluid filled. Okay. So before entering the cochlea further, we will slightly look into the round window. Okay, from which there is a immense importance when we are seeing at the round window with respect to cochlear implant surgery. So the round window is one of the two openings in the middle ear at the level of the cochlea, which allows communication between the tympanic cavity and the inner ear. Okay, and it vibrates with opposite phase of vibrations from the inner ear, producing movement of the perilymph inside the cochlea. This physiology part we will be covering in a different presentation, so we can just move our attention to the anatomical part. So this round window is located at the bottom of a funnel shaped depression called the round window niche, and this particular round window is covered by a membrane called the secondary tympanic membrane, and which can be seen sometimes on high resolution CT. the distances from the round window to the oval window. Now, this is very important. The distance between the round window to the oval window, the facial nerve, are important parameters in identifying a difficult round window niche, and modification of the electrodes may be a better option than drilling of the round window margins for insertion of cochlear implant electrodes. Okay, so the round window is an important structure. Its anatomy has to be really understood well before they actually plan for the insertion of the electrodes. And the round window membrane is normally hidden under a bony overhang termed as the round window niche, which is formed by a posterior pillar, the tegmen, and the anterior pillar. The round window membrane with its niche is termed as the round window pre-chamber. So I hope by now you all know there are basically two processes. I'm sure you will be reading further or you will be knowing better. There is cochleostomy and then there is the round window approach through which the implant electrodes are inserted. So just near the round window, there is a round window niche. I think somewhere near that, the cochleostomy is made. So I think I got this picture. So this is the round window, this is the oval window, and just near the niche there is this hole or a cochleostomy is made from which the electrodes are inserted. And then there are different pros and cons of inserting the electrode through the cochleostomy. And the other way is they are doing insertions through the round window as well. So there are a lot of studies which have comparison between the two processes. The other thing which I want to bring your notice to is the electrodes which are inserted are usually placed in two ways. One is, as we were talking in the previous picture, if you remember the vertical picture of the cochlea, this is the central part of the screw which we were talking, okay, this portion. This is called the modulus, okay, around which the cochlea is wrapped. So, sorry. So the electrodes can be placed very close to the modulus, which is called the perimodular placement, or the electrodes can pass away from the modulus towards the lateral wall. If you remember again the previous picture, we were talking about the lateral wall of the cochlear duct. So this can be placed near the lateral wall. Now again, both the placements have its own pros and cons and implications and contradictions. So that is like out of the purview of this presentation, but I just wanted to draw your note to this, to the anatomical position of the various structure. And the second thing which I want you to notice is the electrode array is usually placed in the scala tympani. So if you remember, we were talking about the scala vestibuli, scala tympani, and the scala media. So the bony tube, there is fluid inside, and inside that is the membranous tube. Okay. So the bony tube, the upper fluid section is the scala vestibuli, the lower fluid section is the scala tympani. So the electrodes are basically passed through the scala tympani. Why? Because the cochlear duct, the middle membranous labyrinth part, it has the floor as a basilar membrane that again contains the nerve endings. Okay. So implantation, what we are doing, we are providing information to the auditory nerve, right? Because the cochlear hair cells are damaged, we are providing information, electric information to the auditory nerve. So the insertion of electrodes have to be very effective and close to the auditory nerve positions so that the transfer of information is very, very efficient. Okay, so I think this is, this should be enough for as far as anatomy is concerned. Rest you can learn in the other presentations. So I just took a break and talked about round window and its importance. This is another picture where I was trying to highlight the position of round window, and this is oval window, and this is the cochlea. And here is the auditory nerve which enters the cochlea. We will be seeing it in the further slides. And here in the inset, they have shown the round window membrane and round window niche. I'm not sure how much clear the picture is, but I'm sure in further presentations you will see better representations. So as I was preparing this presentation, I just bumped into an article which was talking about scala translocation, like the electrodes sometimes just shift from their position where they are kept, and the comparison of both the method, as I was mentioning, the round window insertion and the cochleostomy. So you can see the position of the electrodes. Okay, so this is scala vestibuli, scala tympani, and scala media. The outside is bony, the inside is membranous labyrinth. So I'll be repeating the information again and again during the presentation so that the picture is quite clear with everyone, so that you can visualize it when you are actually reading further. I think I have already done this slide. Okay, this is an interesting picture again. As I was mentioning, to compare the cochlea around the modulus as a screw. So does it look like a screw? I think the flanges, I think so. So the middle of this screw is the modulus, around which the cochlea flanges. Okay, and these skirts of the screw, this is a thin bony plate. Okay, we will be learning about it. This is a thin bony plate. This is called osseous spiral lamina, which again holds the cochlear duct in place. So it holds the cochlear duct in place. So this outer is bony and the hollow inside is fluid filled, and then there is this duct which is membranous. That's the particular arrangement. Okay. Okay. So now we will be speaking about the membranous duct. That's the cochlear duct. It basically has a medial wall. I've already talked about in the previous pictures. It has a medial wall and it has a lateral wall. So the medial wall is towards the middle. It has the modulus around which it is wound. Then there is spiral osseous lamina. There is spiral limbus. We will be talking about each of these structures with pictures. So just don't get anxious. There is spiral ganglion. Spiral ganglion is an important structure because it holds the hero of the whole cochlear implant surgery procedure. That's the auditory nerve fibers emerge from spiral ganglion. And then there is Rosenthal's canal. And the lateral, the outside of the cochlear duct, is spiral ligament and stria vascularis. So these name always, when I was studying and then I was doing recapitulation, so these names always confuse me. Stria vascularis, spiral ligament, spiral ganglion. So these are kind of confusing, but I'm sure when we see it with the pictures, it will be not that confusing. So here, if we see a cross section, so this side is the lateral wall. Okay, so the outside of the tube or outside of the bony tube, this has basically the spiral ligament and stria vascularis. And this side is the medial wall. This is the side which has the modulus, spiral osseous lamina, the spiral ganglion neurons. Okay, and this side has a structure called a spiral limbus, which gives attachment to various membranes. Okay, we will see through it. Okay. So we will start with the modulus, around which the cochlea is wrapped. So this is a central pyramid of spongy bone around which the cochlea turns. The base of the modulus is directed towards the IAM, and it transmits vessels and nerve fibers to the cochlea. And the apex of the modulus lies medial to the tensor tympani muscle. This is the apex of the modulus. Instead of remembering the tensor tympani muscle, we can plainly remember that this is towards the middle ear cavity and the base is towards the internal auditory meatus. So this modulus gives the entry for the auditory nerve fibers. Okay, so we all know from the entry or exit for the auditory nerve fibers. So we all know from the level of brainstem when the nerve fibers are entering, or vice versa from the level of inner ear when the nerve fibers are leaving the inner ear and entering the brainstem area, internal auditory meatus is an important structure. That is a canal through which the nerve fibers pass. So this figure is again of the cochlea wound around the modulus in a vertical position. So this light brown structure is the modulus. Okay. The gray structure is the bony canal. This is the fluid inside the bony canal, and this is the rubber tube. That's the membranous canal. Okay. And when we do a cross section of the membranous canal, we can see the sense organs here. We can see the hair cells, basilar membrane, organ of Corti, all the important sense. Right? So as I was speaking just a while ago about the medial wall and the lateral wall. So this is the lateral side. Okay. So, and this is the medial side towards the modulus. So the lateral side has the spiral ligament and the medial side has the osseous spiral lamina. So these are the skirts of the screw which holds the cochlear duct. Yeah. So after the modulus, the important structure is the osseous spiral lamina. This is a thin plate of bone which winds around the modulus like thread of a screw. So this is a pretty old picture, but of course then it shows the osseous spiral lamina, how it wounds around the modulus. It holds the cochlear duct in place. It gives attachment to the basilar membrane, and it divides the bony labyrinth into 3 compartments. Okay. This is another picture. The central is the modulus. These are the flanges or the threads of the screw. So this is the osseous spiral lamina, and this is the basilar membrane. Okay. So there is this structure called spiral limbus. This structure is just ahead of the osseous spiral lamina. It has an importance because it gives attachment to certain membranes, which are important structures inside the cochlear duct. So the limbus is attached to the superior lip of the osseous spiral lamina. Okay, the limbus consists of network of fibrocytes, capillaries, numerous filaments, and it also consists interdental cells. Okay, so here is the limbus. Basically, it gives attachment to the membranes called tectorial membrane, then Reisner's membrane, and also to a part of the basilar membrane. Okay, so the medial edge of the tectorial membrane is attached to the interdental cells of the limbus. These later cells are thought to be responsible for maintaining the structure of the tectorial membrane. So we will see the tectorial membrane is another important structure with respect to the inner, the main sense organs of the cochlea. So spiral ligament, it forms most of the lateral wall of the cochlear duct and consists of loose connective tissues, and it is rich in iron transporting enzymes. So this is at the lateral wall. Its lateral boundary in the inner surface of the otic capsule, and its medial boundary is formed by stria vascularis. Okay, now the another important thing is the fluid which is inside these tubes. Okay, the endolymph perinymph, as I mentioned earlier. So both the bony tube and the membranous tube has fluids, and the fluids have again a lot of importance in transmitting information, the mechanical vibration which is coming from the tympanic membrane, and then when it enters the inner ear, it is transformed into chemical information and then electrical information. Okay, so this transformation is helped by the presence of these fluids. And these fluids are chemical fluids. They have a particular chemical composition of ions, which, kind of regulate the change of mechanical energy into chemical and then electrical energy. Okay. So it extends into the scala vestibuli and tympani and forms a lateral route of communication between these two perilymphatic channels. And it consists of anchoring cells, which may be able to exert tension. And type 2 fibroblast cells have been shown to contain Okay, now these are the important ions, the sodium and potassium ions. I'm sure you're already aware of it, and also ion transporting enzymes. The other structure which is there on the lateral surface is the stria vascularis. Again, this is of a lot of importance because it maintains the ion composition or the chemical composition of the fluid, specifically the endolymph, which is there inside the scala media. Okay, and it undergoes several processes. It is responsible for producing part of the endolymph ion structure and also reproducing and maintaining the ion structure inside the endolymph. Okay, so this slide basically talks about endocochlear potential. Okay, potential is something related to charge, current, and change of charge. So this we will again come back during physiology. We will not concentrate much right now. So at this moment, we just need to know the stria vascularis and the ligament are on the lateral surface. Now, the stria vascularis has 3 layers of specialized cells, uh, and the hearing depends on the highly positive endocochlear potential generated by the interplay of various ion channels and transporters in the cell types of the stria vascularis. So, the stria vascularis becomes an important structure because, again, as I mentioned, it regulates or it maintains the ion structure or their charges or their potential inside the endolymph. Okay. So the next structure which we will talk about is Rosenthal's canal. Again, this is a very important structure because this is a place or this is a space or this is a canal which contains or which holds the spiral ganglion cells. If you recall, I was talking about spiral ganglion cells which are responsible to give out the auditory nerve fibers. Okay, so this canal particularly holds the spiral ganglion cells. So in this diagram, you can see the Rosenthal canal here, this particular structure. So again, this is a vertically, if we see the cochlea, this is the modulus. And from the modulus, there is this Rosenthal canal. And inside the Rosenthal canal are the spiral ganglion neurons, which enter the cochlear duct from the medial side. So this is the medial side. This is the lateral side. I'll again recapitulate. The medial side contains the modulus, Rosenthal canal, spiral ganglion, okay? And the lateral side contains the stria vascularis, which maintains the ion composition, right? Now, this is an important structure because, again, as I said, this holds the hero which will be carrying the main information from the electrodes to the brainstem. So the fibers of the cochlear nerve originate from an aggregation of nerve cell bodies, the spiral ganglion, located in the modulus of the cochlea. The neurons of the spiral ganglion are called bipolar cells. Okay, instead of reading out the slide, let me give a brief overview. The spiral ganglion cells, there are different types of neurons inside. So basically, these have nerve cells. Okay, so if we all recollect from our neurology classes or anatomy classes, nerve cells have something called axons, dendrites, if you all remember. So nerve cells will have a central portion and a peripheral portion. Okay, so the peripheral portion is responsible for taking in information. Okay, taking in information, and the central portion is responsible for taking the information to a higher level. That is the brainstem. Okay, so when we talk about spiral ganglion cells, the neurons inside this are basically myelinated, and there are 2 types of cells. There is type 1 and type 2. Okay, and all these type 1, type 2 cells have a peripheral fiber and a central fiber. So the peripheral fibers basically enter the cochlea, and the central fiber exit the cochlea, taking information from the cochlea internal auditory meatus to the brainstem. So whatever we are hearing, whatever action is taking inside the cochlea, the information is picked up by the peripheral parts, transmitted to the central part, and then the central part takes away them to the brainstem. So that is what is written. The longer central fibers, also called the primary auditory nerve fibers, form the cochlear nerve. Okay, the shorter peripheral fibers extend to the bases of the inner and outer hair cells. So these are the particular fibers which are responsible for collecting information from the cochlea. They extend radially from the spiral ganglion to the habunular perforator, a series of tiny holes beneath the inner hair cells. Okay. So if we see this structure here, these are the spiral ganglion neurons. Okay, these structures are basically the neurons. They transverse and then they enter the the place where there are hair cells. Okay, the main sensory organs of the hearing, there are hair cells. So the hair cells undergo some changes. They produce electrical information, which is then picked up by these nerve fibers and then carried to the brain. Okay, the interesting factor is these nerve fibers are myelinated till a certain extent, but when they actually reach the inner ear cells or this part of the cochlea, they lose their myelination. So if you all know, myelination makes transfer of information faster because the impulse or the information jumps from one node to other node. Okay, but when the fiber is losing myelination, the transfer becomes slower. The conduction of the impulse or the information becomes slower. Then how is that helpful? So what happens is speech, when we have to understand speech, we need some time window because speech is a complex stimuli. It has a lot of layers of information, frequency, time, intensity, and then time period, duration, everything, spectrum, envelope. So all this information, if all of the nerve fibers were myelinated, we might have missed out important information because of fast conduction. So the slower conduction helps us to understand speech better. So this is like right at the site. This is the medial part. From here, the spiral ganglion cells or the nerve cells are entering the cochlear duct or the hair cells. So part of them supply the inner hair cells and part of them go to the outer hair cells. We'll come back to that later. Okay, so this is something I've already spoken about. So they are myelinated till one point of time. So if you can see node of reindeer, and they have type 1 and type 2 neurons. Okay, and then they lose their myelination after a particular point. So I think we have already briefly talked about the cross section of cochlea. I'll again come back to this because we will be seeing the details now. So the cochlea, if we make a cross section, there is this scala vestibuli, the upper part of the bony tube which has fluid. Scala media, this is the membranous labyrinth or the cochlear duct. It is again having a fluid, and the scala tympani. Okay, this is also filled with fluid. Interestingly, scala vestibuli and scala tympani contain the same kind of fluid. Scala media contains a different type of fluid. So scala vestibuli and scala tympani have perilymph with a different ion composition, and scala media has endolymph with a different ion composition. Okay. Okay, so this is scala. We will be talking about the scala vestibuli, the upper chamber. So this is the upper part of the cochlear canal. It is filled with perilymph. It starts from vestibule, has oval window at one end at the base, and ends at the helicotrema at the apex. So we are talking about the cochlea, which is a coiler structure. It will always have a base and always have an apex. So at the base, it is connected to the oval window, and at the apex, it opens at the helicotrema. And it is separated from the scala media. Again, this is very important. because these two chambers contain different fluids, different ion composition. There has to be a very clear demarcation or separation. Otherwise, if the fluids mix with each other, there will be a major anatomical problem, physiological problem. So they are separated by a membrane called the Reisner's membrane. Okay. So this is a electron microscope picture. I tried to get it. So this is basically the scala media portion, okay, above which is the scala vestibuli, and below this is the scala tympani. Okay. And this side is the modulus and the spiral ganglion, and this side is the spiral ligament and stria vascularis. And these are hair cells. We'll come back to this later. Okay, so the next portion is scala media. I hope I'm audible and visible since I'm not getting any response from the audience. So I'm just checking in case I'm audible and visible and connected.
Yes, madam. We are following. We are following. Please
Yeah.
carry on. It is interesting.
Yeah, thank you. Okay, so this is scala media, the middle portion of the cochlear duct or the cochlea in itself. So the middle portion of the three partitions. This is located between the Reisner's membrane. As we saw, this separates out the vestibule and the scala media. And below, it is separated by the scala tympani by the basilar membrane. Okay. Now, this is again a very important structure. Here is the all, major problem or the major goof up occurs, which is which led to the thought about cochlear implantation. So the ear cells or the sensory organs of hearing lie in scala media. So it holds the sensory organ for hearing, the organ of Corti, on the basilar membrane. So this is the basilar membrane above which the organ of Corti is sitting, and it has spiral ganglion containing cell bodies of auditory nerve at one side and stria vascularis, which produces endolymph and generates the endocochlear potential at the other side. Okay. So this is the medial part, and this is the lateral part of the tube. This part transmits and takes away information through the nerve fibers. So the nerve fibers are entering, and they are entering near the basilar membrane. And this part has the stria vascularis, which is responsible for maintaining the ion composition inside the fluid. Okay. So in the scala media, there is organ of Corti. The organ of Corti holds the sensory hair cells, outer hair cell and inner hair cell, as everybody knows, and it has the basilar membrane at below at the floor, Reisner membrane, tectorial membrane, supporting hair cells, and synapses with the auditory nerve fibers. So these are the basic structures around organ of Corti. And the organ of Corti has something called a tunnel of Corti. It is formed by two rows of pillar cells or rods. So we just move to the picture. Yeah. So this is the organ of Corti. So here there is the tunnel of Corti. It looks like a triangular shaped structure. So this particular structure is the basilar membrane, which gives a seat or it gives a place for the organ of Corti to rest all its structures. These are the main hair cells, the inner hair cell on one side of the tunnel, outer hair cell on the other side of the tunnel, and there is a tectorial membrane over the organ of Corti. Okay, so basilar membrane is down, tectorial membrane is above, and above tectorial membrane is Reisner's membrane, which separates this whole structure from scala vestibule. And below basilar membrane is scala tympani. So when there is cochlear implantation and when they are trying to insert electrodes, what they are trying to do is they are trying to function, they are trying to take away the function of the hair cells. So basically, the hair cells are not working, so there is no information passed on to the nerve fibers at the base of the hair cell. So the electrodes are inserted somewhere here so that the electrodes can give information to the nerve fibers. So if you remember, I was talking about Raman window insertion or cochleostomy insertion. The insertion is done near the scala tympani. So this is the scala tympani. Electrodes lie here and pass on the information to the nerve fibers. Okay. Again, this is the medial side and this is the lateral side of the coil. Okay. So I think I'll just not read. The important thing is this particular tunnel again has a different fluid. Okay. So the scala vestibuli has perilymph. Then this whole structure is bathing in a fluid called endolymph. Okay. But in the organ of Corti, there is this small tunnel which has again a different fluid which is called cortilymph. Okay, the cortilymph is again has a composition similar to the perilymph which is there in scala vestibuli and scala tympani. Okay, and this doesn't mixes with the fluid present in this area or this area. So if there is a mixing of these fluids, there will be a havoc inside the inner ear. So there is this small structure called reticular lamina. So as we are seeing the hair cells and then they have their supporting cells, we will learn about it later. So all the tips of the hair cells, they kind of join to form a thin lamina, which is called a reticular lamina. Okay, and the hair cells have structures above the upper surface, which are called stereocilia. I'm sure all of you have heard, which again go and try to impinge on the tectorial membrane. Okay. So now we will talk about the floor of the organ of Corti or the seat of the organ of Corti on which it is sitting. And also this membrane separates out the scala media from the scala tympani. So the basal membrane again is a very important structure because it holds the sense organs and it has its own typical and very interesting characteristics. Okay, so the characteristics are again related to its anatomy, its composition, its structure. So the basal membrane basically is different from how it is at the base of the cochlea and to the apex of the cochlea. It differs in a lot of things like its stiffness, its length and its diameter. So depending on that, the functioning of the basal membrane and also the functioning of the organ of Corti is affected. So the basal membrane is spanned by stiff elastic fibers that are connected at their basal end to the modulus. Their distal ends are embedded in the membrane but are not actually attached, which allows them to vibrate. So this is another characteristic of the basal membrane that it vibrates. It causes vibration in the organ of Corti, in the hair cell, in the stereocilia as well. Okay, the fibers decrease in caliber and increase in length from basal end of the cochlea near the middle ear to the apex. So the basal membrane as a whole decreases in stiffness from base to apex. Okay, so if we all recall a little bit from our BSc or MSc classes, we will now introduce the concept of frequency coding or different frequency information along the cochlea. So this whole anatomy or whole characteristic or whole structure of basal membrane affects how frequencies are understood or processed at different levels of basal membrane. Okay, so at the base, we all know the base is responsible for high frequency sounds and the apex is responsible for low frequency sounds. So the stiffness which we were talking as it goes towards the apex, it decreases, it becomes flaccid. So that might explain why the lower frequencies are processed or understood at the apex, and the stiffness is more at the base of the baseline of the cochlea. So that may explain how the high frequencies are processed better towards the base. Okay. At the basal end, the osseous spiral lamina is broader, the stria vascularis is wider, and the spiral ligament is stouter than the apex. So this again affects the stiffness of the basal membrane and the whole structure of the basal membrane. Okay. So this is something again related to the description of the anatomy which I was talking about. The basal membrane is wider, flaccid, and under no tension at the apical end, while at the basal end it is narrower and stiffer and under a small amount of tension. And the parameters of the membrane at a given point along its length determine its characteristic frequency, the frequency at which it is most sensitive to sound vibration. So as I was mentioning already. So above the scala media, to separate it out from the scala vestibuli, is the Reisner's membrane. This membrane is again attached medially to the modular ridge of the spiral limbus and laterally to the spiral ligament at the apical edge of the stria vascularis. The Reisner's membrane is composed of two cell layers. Now, this membrane is again having an important function. It should not allow the fluids between the scala vestibuli and the scala media to mix with each other. So, the composition of the cell and layers should be such that it should not be permeable to the ions which are there in the fluid. Okay, so the Reisner's membrane is composed of two cell layers, epithelial and mesothelial, which separate the scala media from the scala vestibuli. The epithelial are separated from the mesothelial cells adjacent to the perilip by a basement membrane. The mesothelial cells are flat, elongated cells that are usually described as forming a discontinuous layer so that there are gaps or pores between them and continuous between the cells lining the scala vestibule. Okay. Reisner's membrane appears to be freely permeable to water, but it restricts paracellular passage of large molecules into the endolymph through the tight junctions. Okay. So as of now, I think this should be enough. So this is a picture which shows the scala vestibuli. This is the scala media we are talking about at the moment. This is the Reisner's membrane, which is separating out vestibuli and media. And we already talked about the basilar membrane on which the organ of Corti is sitting. Now, in this picture, if we see, this is the organ of Corti, this is the tunnel of Corti, and there are the hair cells on both the sides of the tunnel. Now, these hair cells have small structures called stereocilia, which are again very important in the transduction of sound, that is conversion of sound energy from one form to another. These extend and impinge into a flap or a membrane called a tectorial membrane. Again, this tectorial membrane is also of prime importance because it modulates it affects or it kind of regulates the movement of the stereocilia and the hair cells. Okay, so the tectorial membrane is a gel-like structure containing 97% of water. It means covered. The tectorial membrane, again, I have tried to get an electron microscope picture. This is the tectorial membrane, and this basically is the organ of Corti. Okay, this is the osseous spiral lamina. So this is the medial side from which the nerves enter. Okay, and this is the tectorial membrane. So the tectorial membrane is located above the spiral limbus and the spiral organ of Corti and extends along the longitudinal length of the cochlea parallel to the basilar membrane. Radially, the tectorial membrane is divided into three zones, the limbal, middle, and marginal zones. Again, the structure of the tectorial membrane gives its tenacity or a particular elastic characteristic, which is again important for the movement of the stereocilia. So here is another picture. This is the tectorial membrane. This is the organ of Corti. These are the ends above the hair cell. Will come to these structures. So basically, these structures are called to be impinging on this cover. Okay, but again, there are two school of thought. Some researchers say that these structures impinge on the tectorial membrane, but then again, some researchers say that they do not actually touch the tectorial membrane. Some researchers are saying that the inner hair cell structures, the stereocilia, do not touch, the outer hair cell structures touch the tectorial membrane. Okay. So I think I'll not go into the details of the structure of the tectorial membrane. This we can come back during physiology. Okay. Now the actual, culprits which actually, resulted in the thought about cochlear implantation, which actually go wrong or they get destroyed, due to which we have to, stop thinking about hearing aids and then start thinking about something which can directly stimulate the nerve. So the sensory hair cells. So we basically have two types of hair cells, outer hair cells and inner hair cells. So we all have read about this since BSc. So I'm not going into the details, but I have put it in a tabular form so that you can quickly have a recap of what you have done. So the outer hair cells are more in number, okay, and they have a different function compared to the inner hair cells, which are lesser in number, and the outer hair cells differ in the shape compared to the inner hair cells. Also, the physiology, the function. Okay, that part we'll see later. So, since they are differing in shape and a bit of their composition, the outer hair cells are blessed with a mechanism called motility, electromotility. So, their shape can change with response to sound. Okay, but that doesn't happen in inner hair cells. Okay? So they do not change in shape. So we will learn about this in physiology. And outer hair cells are easily damaged. Inner hair cells are more resistant. So we all know when we have a lot of excessive noise exposure or ototoxicity, which are like one of the major causative factors for sensory neural hearing loss, we have outer hair cell damage. Okay. So, and later, maybe when the damage is more, the inner hair cells get affected. So here I have just put two gross pictures of inner hair cell and outer hair cell. So you can see the structure and shape of the cells differ with each other. Okay. So both these hair cells have structures called stereocilia. Okay, hair-like structure, very tiny hair-like structure. So these are the mechanosensing organelles, and these have an important function when hearing is concerned. The movement of these have an important function when hearing is concerned. So each hair cell has several hair-like projections. These are made up of actin. So actin is something which rhymes with the word action. So you can assume that these always have an inherent property to move or vibrate. Okay. These stereocilia are arranged in an orderly fashion so that the small to tall, or you can say short to tall kind of an arrangement. And the tallest stereocilia, it is called the kinesic. Okay. And these stereocilia about 3 to 5 micrometer in length, the longest contact, but do not penetrate the tectorial membrane. But again, this is questionable because a lot of books say that they do not contact the tectorial membrane at all. Okay. Another important feature is about the stereocilia is the tips of the stereocilia. They are connected to each other, and they are connected by structures called tipplings. Okay. So again, when they move at a particular direction, these tipplings open up or close down, allowing some ions to enter the hair cell or exit the hair cell. So we'll learn about it in physiology again. And IHCs have about 40 to 60 stereocilia, and outer hair cells have about 100 stereocilia. So here I have tried to get some picture of outer hair cells and inner hair cells. And I think this is a disruption of inner hair cell stereocilia and outer hair cell loss in the basal turn. Okay. So once we have talked about hair cells, there are these supporting cells which do not take part in the process of hearing directly, but they have an immense role in supporting, in holding the actual outer and inner hair cells in their positions. Okay, so since the time is limited, I'll not go into the details, but I'm sure you'll all have read about the names, the Hensen cell, the Dieter cells, the Claudius cells. So these have some of these cells are supporting the outer hair cells, and some of the cells are supporting the inner hair cells to to make them stand straight and function at an optimal level. So I think here we are just seeing the uh, structures in a in a different form. Here I've just tried to put the supporting cells which are present around the actual outer hair cell and inner hair cell. As the name suggests, they are basically there to support the standing position or support the functioning of the inner and outer hair cell. Okay. So once we have done with scala vestibuli, scala media, we'll come to the lower chamber, that is the scala tympani. And again, if I can remind you, this is the place where usually the electrode insertion is done. So this is the lower chamber. It is filled with perilymph. It communicates with the scala vestibuli through an opening at the apex of the cochlea called the helicotrema. At its basal end near the middle ear, the scala vestibuli opens into the vestibule, and the basal end, the scala tympani, opens into a round window. So we have already gone through this earlier, and it is separated from the cochlear duct by the basilar membrane. And nearby is the opening of the narrow cochlear aqueduct through which passes the perilymphatic duct. This duct connects the interior of the cochlea with the subdural space in the posterior cranial fossa. Okay, now as I was talking about this fluid which is present in scala tympani, this fluid kind of shares its composition. The composition of this fluid is somewhat similar to CSF. So, since researchers were trying to find out how this fluid came inside the ears, so they were trying to find some connection, maybe through the brain, the CSF enters the ear, or there is an exchange of this fluid between scala tympani and CSF. So this perilymphatic duct, or the duct which connects the interior of the cochlea with the subdural space, there might be exchange of the perilymph present in the scala tympani. Okay, so again, if we can recapitulate, this is the scala tympani, this is scala vestibuli, and scala tympani is separated out by the scala media by the basilar membrane. So if you can see, the blue color fluid are the perilymph, the same fluid composition, and the peach or pink, whatever color you can call, this is the endolymph with a different ion composition. But here, this small tiny triangle again contains a different liquid which is somewhat similar to perilymph in composition. That is called cotylymph. Okay. And here again, this picture, I'm bringing it back so that you can see the electrodes are basically passing through the scala tympani. This is the scala tympani, okay, the lower chamber. Okay, so as I was talking about the fluids, there are three different fluids, the endolymph, perilymph, and cotylymph. Again, they differ in their position and also the composition, how they are generated, what is their consistency, and their connection. So I have again put it in a tabular form, so you can just read through it. Of importance is the endolymph and perilymph, because we will see how they affect the hearing, how they affect the transfer of energy from mechanical to chemical to electrical. Uh, I think most of the composition and the presence part I have already covered, so I'll not go into the details of the slides. I can share the slides later. You can read through at a later time when you have time. So, yeah,
Sorry to disturb you.
yeah,
Actually, we have another class at 7 o'clock also.
okay,
How much time will
okay.
you take? Another how much extra?
The nerve connections are left, so I think I'll come just stop with the blood supply, and then I can take up the
Maybe
nerve
next
connection
class
in
we
the
can.
next
Yeah,
class. Yeah,
fine, sure.
yeah.
Thank you, Meenakshi. Sorry to
No
disturb
problem,
you.
no problem. I can understand. So very briefly, this is the blood connections to the cochlea. There is anterior inferior cerebral artery, which supplies the main internal artery to the cochlea. Okay, and then there is of importance the proteins which are there in the cochlea. Again, the proteins depend on the region where the cochlear distribution of protein, the function which they are affecting, and also the binding element. So this is again a very vast topic. I don't want to go into details, but then again they regulate a lot of functions within the cochlea, and they have different positions. So different proteins are present in different positions, affecting the different functions in the cochlea. Okay, so I think we'll conclude here. Um,
Thank you, Meenakshi. Thank you so much for your time. So elaborated presentation. It's like, refreshing everything after so many years. I think now there are almost like more than 30 people are sitting right in front of you. So
okay.
do you want to see them once? I'll just show
Yes,
you.
yes. That will be really great.
Camera, I'll just try to turn it.
Okay.
Hope they are visible now.
Yeah.
Yeah. So
That's nice.
that's
That's
the
really
thing.
nice. I think I'll congratulate Shiva that he's doing a tremendous good job, and
It's
it's
they are
a
the one
pleasure
who
to
came
be.
forward to learn. It's nice to see you. Thank you so much for your time.
My
I'll
pleasure.
talk to you again. Maybe
Yeah.
next month we'll meet up again once again.
Yeah.
Okay. I'll
Yeah.
take your time and date, and then I'll
Yes.
fix it.
Yes. Thank
Thank
you
you,
so much.
Meenakshi. Thank you
Good
so
night.
much.
Good.
Okay.
My
Good
pleasure.
night.
Good night,
Bye-bye.
everyone. Bye.
Bye. Bye.